entering into a string of BMT questions. And Dr. Faisal, please get ready for the next couple of questions and feel free to keep it as succinct as you can because this is a live event and we need to get to all the questions. So the first question is, how are stem cells generally harvested from the donor? And what is the probability of GVHD with an allo transplant?
Yeah, so I think I kind of missed that part on my talk that maybe you should have focused. So thank you so much for asking that question. So there are two ways of harvesting or getting the stem cells from a donor. One is a collection from the blood. So the way it works, we do that for most of the stem cell collections, if, including auto collection, all of them, and most of the allo collections as well. So the way it works is we give you injection for 5 days called GCSF, and then that kind of stimulates your bone marrow and gets the stem cells into the peripheral blood, and we collect the those stem cells from the peripheral blood by putting 2 large bore needles or a big cannula in the neck, and it goes like the way you get or someone gets a dialysis. So we get the blood out of into a machine, separate those stem cells and other white cells, and get rest of the blood back to the patient. Takes about 4 to 6 hours. Collection process is definitely a bit challenging for patients who are getting an auto locus collection because they have seen a lot of chemotherapy. So sometimes those patients need a second day or a different injection to stimulate the bone marrow and get the stem cells get more stem cells out. For healthy donor, the collection usually is completed within 1 day. The other way of collecting stem cell is by doing a bone marrow harvest, which is done for, which is now in these days mostly done for benign conditions, like if someone is getting an allo transplant for aplastic anemia or thalassemia. In those situations, and a lot of pediatric centers still request bone marrow harvest. So the way it works is you go in an operation theater and put the patient under anesthesia and collect the stem cells from the hip bone by doing multiple punctures in the hip bone and collecting stem cells that way. That is being used less and less these days. The probability of GVHD, so it depends on a lot of factors. What transplant are you getting? If you have a matched sibling donor, if you have a younger donor, if you have a male donor, all these things decrease the chances of having GVHD. It still happens in around 50% of patients. Severe GVHD happens around in post-transplant cyclophosphamide era, which is the prophylaxis that we do for almost every transplant now. The severe GVHD, clinically significantly severe GVHD happens in around 20% of the patients in these days. And then for chronic GVHD is also again around the same number. We actually we want to have some GVHD, but not a lot GVHD. So when I trained in transplant, my attending, he mentioned that we want GVHD to be a switch where we can turn to a lower side than to have a button that goes on and off. So we want it to be on lower spectrum so that the graft versus leukemia effect that we see with that can be present as well.
Sounds great. Thank you for that.